Absolutely. My name is Lisa Bagci, and I am the director of the Cancer Center here at Cookeville Regional Medical Center. I've grown up in this community. I was pretty much born here, raised here, and went to school here, and it's part of who I am. I became the director in 2004, although I came to the Cancer Center when it opened here in 2000. And I worked here in another capacity, and then I was asked to be the director in 2004 and have been ever since. I have been in the medical background. I started here in 1988. This is my 24th year. So I was at Tech and was working here at the hospital part-time, getting my business degree. And during that, I figured out that I liked healthcare quite a bit. So I went back to school and got a health information management degree, and I've been here ever since. Well, I manage the day-to-day operations of the Cancer Center here. We provide medical and radiation oncology, so I have to do that. And then in addition, I'm making sure that we are always providing the care, offering new services, make sure the direction that we're going is in line with the hospital's mission and vision, as well as what our patients need and what they deserve. I really spend as little time in my office as possible, because my heart is out there with the patients, and of course I have to be in my office quite a bit. It is very office driven, but my best day is when I am out and I get to visit with patients and hear their input and get their feedback on what we're doing well and what we need to improve on and how we can make their care the best it can possibly be. That's the favorite part of my day. The cancer program started at the hospital back in the 90s when we offered chemotherapy, and the hospital determined that we need to have a formal cancer program that offered more services, and the Cancer Center opened in 2000 so we could provide radiation therapy in addition to the chemotherapy and the surgery that they were already doing here long ago, and have been doing a very good job of it. It just kind of pulled all the pieces together that we need to do to treat a more well-rounded approach to cancer care. And we tripled our space when we moved. We had another area within the hospital that was about 8,000 square feet, and where we're at now is about 30. We diagnose about 800 new cancer cases a year. Most of them are inpatients. They get their surgery by their surgeons, and then if adjuvant treatment is necessary, radiation and medical oncology, they'll come to the Cancer Center, which is outpatient driven. So we complement inpatient, outpatient, and then all the ancillary services that a patient has to go through, radiology, pathology, everything comes together, and then their outpatient part of their treatment, we kind of end it. We make sure they get through treatment and get everything that they need after their diagnosis. And it's a team effort. There are many physicians, nurses, staff involved in that patient's care, some of whom the patient may never meet, like a pathologist or a radiologist. It's very important what they do, and the patient is the benefactor. It's a blessing. It is an absolute blessing for this community that we can have the care that bigger cities provide right here in our own neighborhoods. We treat family, we treat friends, neighbors, and relatives. We're a regional medical center. We treat everyone from the 14 counties because this is where they need to come for their cancer care, because Nashville and Knoxville, they offer cancer care and they offer similar cancer care, but they don't offer better cancer care. We do it just as well here in our community. I tell patients, you're getting the same treatment here, you're just getting it in a different zip code. They're using the same therapies, the same drugs, and sometimes we're a little ahead of the curve more than they are, but there is a stigma to being treated close to home. But I think we're starting to break that. We certainly have seen a large trend towards breaking that here in Cookeville. We want to make it as easy as possible for patients who are getting their cancer treatment. It doesn't have to be difficult. We want to make it as easy as possible. So when you come here, we want to make sure that we're taking care of everything we can take care of so they can just concentrate on getting better. That's our mission. Well, we are fortunate to have such a strong relationship with Susan G. Komen for the Cure and other agencies that provide funding to offer free mammograms to women who don't have health insurance or only have a catastrophic policy where their deductibles are so high they wouldn't get a mammogram. It's so extremely important for women to get a mammogram that provides that early detection of breast cancer. Many women do not have the funds to do it. Groceries, medicines, kids, everything comes first. And without that funding, many women would go without. And our goal is that no woman should ever have to go without a life-saving mammogram. It's too important for their health. Early detection is the key, and you can't early detect anything without a mammogram. So we are so fortunate that Susan G. Komen has partnered with us to provide those funds for women all over the Upper Cumberland to get that life-saving test. And it takes that conversation for women to get plugged into their health, to understand that they need to come first sometimes, and they need to make time to have a mammogram. And if they don't have funds to do it, we'll make a way. There are funds out there. Just do it. Do it for you. It is so easy. All they have to do is pick up the phone and call our imaging department at 783-2222. Tell them they do not have insurance and they would like to get a mammogram on the next free mammogram day, and they'll be scheduled. And then once they get here, we'll take care of them, do their mammogram. It's painless. They're here 15 minutes, and then they can go about their day. And they can feel good knowing that they got their cancer screenings. We do it about every month, every 6 weeks or so. We have an event, so there's always one around the corner coming up. There are options, and there are things out there for you. You just have to come get it. I would advise women to be your own personal advocate for your breast health. Make sure that you are getting your screening, your pap smears, your mammograms, all your good cancer screenings, and to know your body, and to know when something is out of the norm, so that you can tell your doctor and have the conversation with your doctor, and always know when you are due for your mammogram so you can get it done. People let it go 3 and 4 years, and they're very shocked when you ask them, when was your last mammogram, because they truly can't remember. Be diligent about that, and we can catch cancer at its earliest stages so it's most treatable. So I think that is the most important take-home message for women. Early detection is key. Professionally, I have seen such an increased awareness in our medical community, certainly in our patient population, about breast cancer. I have seen women who volunteer at events, who get involved, and as a result of that, they're more in tune about their own health. And this goes all across the Upper Cumberland. I've seen more women come out about getting their mammograms, being that good advocate for themselves and the people in their family. Women influence a lot of other women through their church relationships, their family relationships, their work relationships. And I think the power of that as women influence women is huge, especially for our area. It takes that for everyone to get on board about their cancer screenings.